discuss housing in relation to racial equity. In each episode, we've also incorporated income inequality, which continues to be prevalent in each topic, including access to healthy foods. Today, we'll talk about income inequality and housing's intersection with transportation. A report called Moving to Equity defines transportation equity as while most transportation planners are concerned primarily with the efficiency and cost of transportation, including people's mobility levels and the accessibility of transportation to the most people, those concerned about transportation equity seek fairness in mobility and accessibility levels across race, class, gender, and disability. The ultimate objective of transportation equity is to provide equal access to social and economic opportunity by providing equitable levels of access to all places. So how does transportation relate to housing? Policies to increase space for vehicle transportation, such as freeways, have displaced minorities and low-income communities. Freeway placement and expansion is often in urban areas of low value, which is overwhelmingly low-income and minority communities. While these projects can be seen as beneficial in many aspects or even as urban renewal, it destroys and reduces housing, further breaking apart and pushing these demographics into different regions. Let's look into transportation funding in Maryland. This can be hard to do for many reasons, but the Moving to Equity report shows that county boundaries coincide with the City of Baltimore's boundaries, making it easier to analyze. An unpublished analysis of the Surface Transportation Policy Project shows that Baltimore receives the lowest federal highway funding per capita in the state, $121 per person, showing a clear preference in funding for suburban and rural counties. This information can't be minimized to specifically minority or low-income communities, but we can compare it to the City of Baltimore's racial makeup. Baltimore City is 62.7% Black and 5.7% Latino or Hispanic, according to the 2010 census. In Maryland specifically, access to transportation can be an income-related issue. Since income inequality and wealth disparities are prevalent in communities and households of color, this also becomes a race issue. While the most obvious inequity is that cars can be incredibly expensive, the process to get a license for cars in the state of Maryland is also complicated. There are several seemingly simple steps towards getting a driver's license. The first is to get your permit by going to the MVA and taking the permit test on driving laws and regulations. One barrier for this is the fact that an individual must not only have the time outside of school and studying, but must also have transportation to get to an MVA location at the scheduled time. If these aren't issues, you also need to pay a fee for your learner's permit. If these don't pose obstacles, here are some that might. The state of Maryland requires every student attend driver's education, which isn't free. Individuals interested in obtaining a license must have the time and money, typically a few $100s, to arrive and attend driver's education at approved locations. On top of this, the individual must have access to their own car to practice driving for 60 hours, 10 of which must be at night. Taking the driver's test for your license has similar barriers to the permit test, a financial and time-consuming commitment, which you also need your own car for. There's also a more specific barrier to obtaining a driver's license, and that's citizenship. For starters, to obtain a license in Maryland, you must provide documentation of in-state residency, birth certificates, social security numbers, and other things. Immigrants have jobs and lives that require commuting not only within their neighborhoods, but between cities and states as well. The barrier to get a license can mean paying for long commutes via public transportation or driving illegally with cars that they already have. Otherwise, their ability to participate in many activities and necessities is greatly reduced and inhibited. In a report by the American Immigrant Council, licensing drivers based on ability to drive improves public safety. Conversely, the exclusion of unauthorized Latino immigrants from eligibility for driver's licenses and insurance, and therefore from proper road safety and driving tests, is likely to result in more dangerous roads and higher costs for insured drivers. By making licenses and vehicles more accessible to immigrants and communities comprised of immigrants, there will be more social and economic benefits. Many opportunities are created by allowing more individuals that contribute to a community capable of thriving and taking advantage of their surrounding environment. A lack of transportation can also be a barrier to voter accessibility. While a car or a driver's license isn't necessary, public transportation only runs through limited time periods. For individuals who work long hours or have to go to school for long periods of time, or both, getting to voting places can be hard, especially for the elderly and people who live in rural areas. An example of equitable solutions to this is how the state of Minnesota provides transportation to voting places, shuttles for college students, and no-excuse absentee ballots to vote by mail. Individuals with disabilities are especially impacted when it comes to voting accessibility and transportation. According to the Economic Policy Institute, workers of color are far more likely to be paid poverty-level wages than white workers, which can correlate with more working hours to make a living fair wage. This stunts accessibility to voting, especially when some voting places close early, even around 5 o'clock, which is detrimental to the working class's voting accessibility. Access to healthcare is also impacted by transportation accessibility. But how does this relate to race? As mentioned in our episode on healthy foods, people of color are more likely to have certain health conditions such as obesity, heart disease, cancer, and strokes, which has higher rates in impoverished communities. According to a report called Communities in Action, while the mortality rate for non-Hispanic white babies is 5 in every 1,000, that rate jumps to 11 in every 1,000 for African Americans. A lack of access to transportation can be detrimental in many ways for people of color. The report also says that transportation costs are a barrier to mobility for households in poverty, disproportionately represented by African American and Hispanics. While Ubers, taxis, and other driving services are available, the cost increases based on distance. For these communities that are a long way from grocery stores, they tend to also be farther from hospitals that provide adequate health care. Also, promoting more active means of transportation, such as walking and biking, can reduce health risks and conditions in African American and Latino communities that are disproportionately impacted. The Washington Post recently wrote an article on the impact of the coronavirus pandemic on public transportation, especially in Washington, D.C. and surrounding areas. Space on public transportation has been reduced and de-densified to reduce the likelihood of virus transmission, meaning transportation is much less accessible for people of color and low-income communities that heavily rely on it. This poses the question as to how to safely make transportation more accessible amid a pandemic for those who rely on public transportation so much. The current state of the pandemic and its effects on public transportation accessibility shows a range of inequalities across the country and in major cities like New York, D.C., Seattle, and Chicago. In many cities, such as Los Angeles, public transit is used predominantly by individuals who make less than $65,000 a year. Another obstacle to transportation can be language barriers, which overwhelmingly impacts minorities. According to a Washington Post article, there were a lot of signs pointing and explaining specifically what not to do when riding on a bus or metro. These signs were for Spanish-speaking riders, listing things like "Don't bother the driver." At the metro station, signs on how to get fare cards or add money were only in English, something that's especially important for speakers of any language to know if they want to continue using the metro, which is often for getting to work or school. Even emergency and safety signs were solely in English, which is detrimental to everyone in metro trains cars when evacuation or other safety measures are required. Barriers to transportation accessibility pose to be very prominent for minorities and low-income individuals. They're also incredibly easy to overlook. While we should continue to remember that being low-income isn't solely an issue for people of color, and not all minorities are low-income, the overlap of these concepts can't be ignored. Transportation accessibility disproportionately impacts minority communities, similarly to access to healthy foods and food deserts across the United States. In our next episode, we'll talk about the history of Black colleges and universities, language barriers in education, and other educational inequities related to race.